Hey guys, it's Natalie, and this is the Health Tech Hot Seat. I am so excited for you guys to hear today's episode. This was from my Live at HIMSS 2026 series. Today, I'm interviewing Dr. Laura Cooley. She is a lovely soul with a PhD in healthcare communications. She's an expert on the patient experience and on what it means to engage patients, caregivers, and family into making a healthcare experience and a product that is really reflective of their true needs. So, without further ado, here's my interview with Dr. Laura Cooley.
Hi everyone, it's Natalie and we are here at HIMSS 2026 and I just got hit by a cord, but I think I'm okay. But I am here with the absolute what is happening? Can I pose next to it? I am here with the absolutely lovely Dr. Laura Cooley. She is a patient experience in a communication expert. That was what your PhD work was in, correct?
Yeah. So a PhD in communication and healthcare, but my real education was when I had true family experiences that helped transition me to get a more authentic view of patient family needs and what matters to them.
Yeah. And so I was in this session with you today. You had, first of all, there were props, guys. Okay. She had these incredible symbols that symbolized bringing us back to the moment. And how you started that session was this incredible take on presence and that at the bedside, presence can be the most important. And how do we use technology to increase our presence? And so I just want to say thank you so much for starting a session like that. I loved it. But I want to hear, when you think about health tech today in 2026, where do we need to be more present? And where do we need to have a better viewpoint or a better honing in on the patient experience?
We're so distracted by technology. And I think the promise right now is that ambient listening and other AI solutions are going to help us focus on the human in front of us. And at the same time, I think we're busier than ever looking at our screens, asking our AI to give us more intelligence and all sorts of things. So I think we have to really pause and stay focused on what matters to real human people to enable a connection that is authentic.
So what is the question that founders should be asking when it comes to patient experience? And who should they be asking?
When we think about founders and patient experience, I think it's easy to think about patient experience in a very surface level way, or to think about it as something we survey about or ask questions about. But, patient experience is much deeper than that. It comes to like the metrics around trust. Like, can I trust that you respect me, that you care for me, that you're looking out for my best interests? Are you listening to me? Are you hearing what matters to me? And are you acting accordingly? And when people are in their most vulnerable moments in a healthcare space, even if it might feel small to the provider or to the tech company that's offering some service, it's big to that person who's suffering. And their suffering is micro suffering or it's macro suffering. And I think we have to really dial into that when we are founders trying to develop solutions so that it doesn't seem surface level, that it seems deep and real and human.
In your talk today, you said that, you defined patient experience in a way I've never heard before. And it was the meaningful reduction, right, of
Avoidable suffering.
suffering.
Avoidable
Suffering.
because we suffer
Yeah.
inherently.
Sure.
And I'm not the first person to talk about this, but we often shy away from acknowledging that we're suffering. If we're managing some kind of health condition for ourselves or those we care about, that's suffering. And we can't take that away from our patients or from our families. We can try to reduce the avoidable parts like poor communication, a lack of empathy, a lack of listening, poor access, and inability to see our records, to understand what's happening. Like those are avoidable suffering points. And we can reduce that friction if we're really intentional with design.
When we talk about, reducing avoidable suffering, how does that pertain to staff and products that are maybe staff facing or touch healthcare staff in some way? Can we reduce their suffering?
We definitely can, and we can accidentally increase their suffering if we're working in a vacuum. Like we're developing one really cool solution and we're a founder of a product or offering that is really cool in itself, but it has to integrate with all the other complexities of what's happening for staff and make their life easier holistically. Like if it's cool in one way, in one solution, but it doesn't address the whole like picture of what's happening,
Mhm.
then I think we're missing the mark.
Something that I thought of during your talk was, you asked this question of, do we know what's the most important for the patient? And I was reflecting, on my time as a
Yeah.
clinician, and I thought to myself, how do I ask that? So in your work and your studies and your research, how does a clinician like me or a product developer who might be watching this, how do we ask the patients in a meaningful and not too intrusive way of what's important to them?
Yeah.
How do we engage that conversation?
I think it's easier than people think.
Mm,
So, like,
yeah.
Natalie, what's important to you about this conversation? Like, what do you want to get out of this? Like, what matters to you at the end of these few minutes?
Yeah.
Right? People have answers for that. We just rarely ask them. So I think it's actually simpler than you think. And I cited a research study today, published in 2021 in the BMC Services Journal. And that study asked more than 1,800 people in a very quick interview moment, like, what matters to you? Why? And do you feel your provider or your doctor knows
Knows that.
what matters to you? And those three quick questions led to a huge reveal of data. And if people don't want to answer, fine, but they do want to answer. And I think we can design our tech solutions to also ask that question, even if it's in the form of like pulse surveys or asking our AI agents to find that out. Like, we can program a lot of this.
And if I remember correctly, you said in that study was 51% of respondents didn't think that their provider
Knew what
knew.
mattered to them.
That's crazy.
That's right.
51%.
That's right.
And then, last question, you harped a lot today on trust.
Yeah.
You cited a study that said in the spring of 2020 that U.S. Consumer trust in the U.S. healthcare system was, around 70%.
Yep.
And was it April 24?
Yeah.
Had plummeted to
Around 46.
around 40%.
Yeah. And so that doesn't surprise anybody.
Sure.
Because we all know we feel distrust. We see distrust. And the challenging thing for a provider like you, you're at the bedside, you're taking care of patients in a really active way, is that you're great. But the last experience they had
Sure.
was not great. And they lost trust a long time ago. And they lost trust in the whole like state of
System.
humanity,
Yeah.
in the system, in the political situation. And so we have a lot to work back towards, and the ways that we can show up and be more authentic, to design our tech solutions,
Mhm.
to think about human connection and what matters to the people we're serving is what will make a difference.
As a way to restore that trust.
Exactly.
Yeah, I love that. Okay, 3 more questions. It's rapid fire. Hey, I'm with Laura here, Dr. Cooley. She is in the health tech hot seat. We have 3 questions for you.
Okay.
HIMSS 2026. First one, what is an AI hype that you call BS on? What is BS?
That ambient listening is going to give time back to restore the relationship.
Mhm.
Here's my BS moment. Yes, and only if we protect that time. Because if we regain that time and just put it back in to some other task or one more patient, we lost that relationship moment.
Yeah, I totally agree. What is one AI hype that you are all in? You think it's legit? You think it's real? You think it's happening? It could make a difference.
Ambient listening. Here's why.
And yeah.
Here's the and, is that if we can do it right, if we can take the extra time that we're claiming back for our clinicians to protect it for the patient relationship and embed integrations that ask the right questions, that capture the right moments, that hear the patient's story, that hear the emotions and capture those in the notes and make them highlighted, maybe even give feedback, then we have ambient listening that is really authentic, as I like to call it.
I love it. Guys, this was Dr. Laura Cooley. She is an expert in patient experience. She is an absolutely fantastic speaker, panelist, and now new friend. I want to thank her so much for being here on the Health Tech Hot Seat, and we're going to sign off from HIMSS 2026.